Give us a variant update. I get mixed articles, mixed messages. Should we fear the variants?
So thank you very much, Tom, for having me back on again. So with respect to variants, yes, we should fear the variants. What we've learned over the last several months is that these variants can be more transmissible, and they can be also more virulent. They can cause increased risk of hospitalizations and deaths. So that's important. So the question is that, what is that threat, specifically here in the United States? So we know now that we have widespread transmission of the B.1.1.7 variant. That's the UK variant. And that certainly is more transmissible, and it's also now increasing evidence that it may be more virulent.
Will these vaccines protect us against that? As you sit there, the expert in New Haven, do you suggest we're all becoming a little too enthused?
Yeah, so certainly the good news is the rollout of vaccinations, and I'm particularly proud as a citizen of Connecticut that our state's doing a great job in getting almost 30% of its population vaccinated. The big question is the one that you've just asked, Tom, is that are we going to have what we call vaccine escape variants or mutants? And we have some inkling that may be the case in South Africa. With the variant that has arisen there. We're also worried about that with the variant in Brazil, which is causing a humanitarian crisis there in that country. So there's going to be more to come. But I think the bottom line is that you can only get mutations if the variants replicate. And the best way to prevent them from replicating is to prevent transmission and controlling transmission, whether it's through public health prevention or whether it's through vaccines.
All right, preventing transmission, that's exactly where I wanted to go. In particular, how it had to do with AstraZeneca's vaccine and the idea that you have an increasing number of European nations raising concerns about the incidences of clotting after the injection. What's your take on the evidence here? Do you think that there has been enough evidence to show that perhaps there should be a pause put on the AstraZeneca distribution?
So I think it's important to note, Lisa, that several European EU countries have suspended the use or temporarily halted the use because of these concerns on blood clots. But they also acknowledge that there is not enough evidence to show that there's a causal relationship between receiving those vaccines and those blood clots. I think it's important to remember that, in the general population, blood clots happen once or twice for each year for every 1,000 people. And there have been tens of millions of people vaccinated with the AstraZeneca vaccine. So certainly the 40 cases that they've identified could be just the background rates that we see in the population. So at least in my personal opinion, we haven't seen any smoking guns or anything that shows that these vaccines are other than being safe as well as being effective.
Doctor, is it what you would expect early on in the vaccination process in Europe to see these kinds of incidents happen, given who we are vaccinating first?
Most vaccination programs have been particularly focused on targeting the elderly who have, and people with underlying medical conditions have higher risk of poor outcomes from COVID in order to protect those populations. Those are also the populations that also have increased complications, just baseline complications due to the underlying medical conditions. So again, those rates that we're seeing, these are 30 cases among 5, 10, over millions of people that have been vaccinated. So these are very low. And again, these may not be a causal association between the vaccine and these very rare events.
Dr. Ko, there is a larger question here, though, of whether there is a huge difference between the different vaccines available. In other words, a lot of health officials have tried to prevent vaccine shopping, but is there a material benefit to certain vaccines over others?
So from the public health point of view, I think the first objective or first goal of a vaccine is to protect people from dying from the disease or having the severe complications. And all the vaccines that have been approved in the EU and the United States and WHO, have shown that those vaccines are highly efficacious. There may be some differences between whether they protect against milder forms of the disease or infection. That's information or that's evidence that we still need to get, as these vaccines are being rolled out. But those are really small, probably minor or less important differences. I think the big issue is that the key issue in getting out vaccines is the accessibility and the ease of implementation. And I think one of the big game changers has been the J&J vaccine. To give a vaccine that's one dose, you can imagine, and doesn't require complex cold storage, in very low temperature freezers.
Yeah.
That's a big lift all around for many segments of the world's population.